We are in August 18th. We facilitate these all-call partner meetings every quarter, similar to our steering committee meetings, which is the leadership of the Act on Homelessness Collaborative. I'm Barbara Anderson. I'm the collaborative facilitator, and I have my colleagues Landon Rank, our administrative manager, Jeff Schaefer, director of initiatives, and our newest team member addition, Kayla Peterson, who's our program coordinator now with SB Act. Good morning, good morning, good morning. We are here. We're excited to see all of you. Love to see the engagement. We know that the topic of homelessness, although super complex and really challenging, we've had a lot of engagement, participation, incredible conversations, innovative ideas, conversations that have been happening before I joined and got involved in this issue. Many of these dialogues have been happening for a decade plus. I feel as though we are getting a little bit deeper. We're getting a little bit more specific about strategies, solutions we can try, and we're not ruling anything out. So I think everything's on the table. We've dug in a little bit deeper, and I will say I feel the sweat, blood, and tears of our collaborative partners, because not only have we asked them to be at these tables continuously to think, again, creatively and innovatively about homelessness in the city of Santa Barbara, but they are doing their day-to-day work. And that has been no easy task in the past year and a half, nor has it ever been an easy task. But we are still actively in responding to COVID. And I know that the county has transitioned to a recovery phase, and this recovery phase will come with it a lot more challenges. So we are bracing ourselves as much as possible for what's ahead. And I don't think I saw Mayor Murillo on. I know that she's juggling a lot of meetings. She serves as our co-chair with Councilmember Gutierrez. All right, so we usually start our all-call meetings with letting you know that we've made some progress, and we have absolutely made progress in the second quarter of this year. So I'm going to go through a few PowerPoint slides. Please feel free to add a comment, a question in the chat. Kayla will be monitoring that and can interrupt me to make sure that we're answering your questions along the way. I see too some introductions in the chat already, which is great. Here, I'm going to pull my screen up right now. Can I get a thumbs up, Kayla? You can see that. Great. All right, we're going to start with our working groups. And as many of you know, we have 4 very active working groups. One on homelessness prevention, another on housing and shelter, one that is kind of has stemmed from the homelessness prevention group, which is specific to housing retention, and our lived experience working group, which is just making sure that those who have or are living the experience of homelessness are contributing to every part of our collaborative work, from our leadership team with Roger Powell to our strategies within our working groups, as well as our regional action plans. So starting quickly with the homelessness prevention working group. So this has really centered around sharing information on new and existing financial resources, making sure that we're serving our residents that have experienced the economic impacts of COVID-19, getting the financial assistance that they need, whether it's rental and utility assistance. We also have an organization, Cecilia Fund, that helps with medical care expenses, and then legal assistance through organizations like the Legal Aid Foundation. We also have been prioritizing strategies around diversion and reunification. And so we define this to be any opportunity to work with and engage someone who's living the experience of homelessness, really understanding if there's family or friends that they can reconnect with, if there's a job opportunity that they could possibly pursue, if they had the resources to return to a different geographic region, or really anything else that they have said, I used to do this, I used to live here, I'd love to go back, but I don't have the resources to do that. Not only are those opportunities thoroughly vetted, but there is follow-up after that placement and referral has been made. So it is a very formalized process, it's comprehensive, and it requires flexible resources to be able to make that happen. But we know it's the lowest cost, highest impact strategy that we can deploy in homelessness prevention. So that can be in a short period of time, or that person is about to experience homelessness or lose their home, or again, they haven't experienced chronic homelessness. The last piece here is making sure that we're working to engage all service providers and coordination of prevention programming. So this is our homeless care and shelter providers, but it is a lot of providers that we have in our community, and we're lucky to have, that are serving low-income families, underserved communities in general, our vulnerable populations, all making sure that we're doing whatever possible to address their needs during the COVID-19 response, but also to support individuals and families in general, making sure that they're able to stay in their home, address any hardships or financial issues that they've been experiencing, and ultimately to help them thrive moving forward so that they can be self-sufficient and they can, again, support themselves and their families moving forward. Our housing and shelter working group, this is a huge meaty part of our strategic plan. So our 3-year strategic plan has 4 high-level goals, and we will be reporting out on those goals annually, because moving the needle in those areas takes all hands on deck, as well as coordination with data collection and analysis with the County of Santa Barbara. Quarterly, we report on specific progress as it relates to our regional action plans. So you see here our working group updates and progress are mainly around the strategies we're deploying, what we're learning, if we have had to make shifts, if we're reprioritizing or creating new strategies to deploy in the community. These are the type of updates that we will share with all of you. So housing and shelter is the core part of our strategic plan long term. But in the interim, we want to really focus on specific strategies. And one of them has been around bridge housing. And so we know that this is a gap countywide in terms of providing more opportunity for individuals who are exiting the street to be able to be stabilized, to have really specific support around mental health, substance abuse, addiction, mental health issues in general, and ensuring that we're creating an individualized housing plan and being able to make referrals and placements based on that housing plan. So really finding a suitable place for them to live that meets their needs. And again, when we're talking about thriving, we want them to be successful in that housing placement and making sure that they get the supportive services that they need to be able to be retained in that housing unit. So it is a lot of providers working to ensure the success of this continuum. We know that there are gaps in that system. And bridge housing, we are advocating more bridge housing units countywide. And so already we've been successful in the bridge housing program in the city of Santa Barbara. So the city of Santa Barbara City Council approved $480,000 for a bridge housing program early in April of this year. And you'll see the progress to date as it relates to that bridge housing program a little bit later. And we also were able to really bring before the city council, in coordination with city staff, leadership, all of our service providers, more bridge housing units for the encampment response. So this is responding to encampments in fire-prone areas and ensuring those who are being displaced from those encampments have safe shelter and the opportunity to do whatever it takes to get them placed into a more permanent housing unit. So successful in terms of resources being allocated, service providers having additional financial resources to expand their capacity to meet the demand of the bridge housing units. And we are finding that the progress being made, the experiences of the clients that we're serving is really just so positive. And we are absolutely affirming that this is a best practice approach. And again, we'll share those results a little bit later in our presentation this morning. The other piece is the mental health crisis response, as well as ensuring that those who are placed in housing have the proper supportive services related to mental health. So we know that this is an ongoing challenge. It's not just a challenge for individuals experiencing homelessness, but it is a challenge for our neighbors in general. And we know that this has increased exponentially because of COVID-19, the stress, the fear, the anxiety, the worry about, again, if people are experiencing economic hardship, that this is really escalating mental health in our community, mental health needs in our community overall. No exception are individuals experiencing homelessness. And it does take licensed professionals, it takes experienced professionals to be able to do this. And we know that behavioral wellness, CityNet, and other providers are heavily recruiting new team members to be able to meet the demand here. So we have been going through really specific case studies to understand what we can do to advocate for more improvement in the system, advocate for additional resources, but as well as making sure that we're coordinating effectively, we're communicating effectively. If there's anything we can do as a collaboration, that we're working wholeheartedly to be able to do that. So mental health has been prioritized in our housing and shelter working group, and that is the main topic for our working group meetings that occur monthly. Going into housing retention, and I see that there's introductions in the chat. Great. I don't think we have any questions yet. So Kayla, thank you so much for checking that out. Housing retention, again, this was really as a result of our homeless prevention working group conversations of what can we do specifically to make sure that there are appropriate supportive services and that we're managing and advocating for smaller client to case manager ratios, and that we're addressing under-resourced and unfunded needs. So everything from utilities not being included in terms of rental subsidies and other housing vouchers, household goods. We're finding that not only do residents have to be creative and scouring Craigslist and Nextdoor and Facebook Marketplace, but our case managers are doing that as well, because anything to make sure that individuals who are newly placed in housing feel a sense of home, feel a sense of community, we know that they're going to be more successful in that placement. So it is looking at every opportunity. Could we support something more comprehensively? Could we advocate for more in-kind donations or contributions? Or in general, looking for more flexible resources there. And Raj, as I say that, I'm transitioning to the lived experience working group. Even your experience being placed in this beautiful home, making it your own, and you really understanding what it takes to be on that journey, you have worked to bring together a really incredible group of people that are sharing their perspectives, their experiences, their insights, how we can do better, how we can improve, how we can really concretely and impactfully support those who are experiencing homelessness to, like the County of Santa Barbara says it, make it brief, non-reoccurring, and making sure that we're doing whatever we can so that they're on a successful path moving forward. But Raj, is there anything you want to add just from your personal experience or just the interactions and dialogues that you've had with the lived experience working group?
Well, yesterday I was able to recruit 2 new members for the lived experience group, and they're 2 very awesome individuals. They both work for Showers of Blessings, so I'm really looking forward to working with them. And there's one other issue I would just like to bring up for everybody. There's been a number of complaints about the shopping carts on State Street. And one idea that I had is to get them, they're not just going to go away overnight. So one of the idea that I came up with is to give them something that is very pretty and appealing to put over their cart. That's one of my latest ideas.
Oh,
because,
okay.
Yes.
So you're just saying if we could make it easier on the eyes, if we could make it a little bit more contained so that folks we know, again, these are personal possessions that are, folks are very and understandably protective over, could there be a compromise? Is that what I'm hearing, Raj?
Yes, because they're not all going to go away overnight. And until we get the lockers, and even after we get the lockers for the homeless, yes, I think it would make it more appealing because, some people don't like looking at them.
And there,
the
I know
public.
that there are ordinances in place now with the city of Santa Barbara, but I appreciate that because we've been working collaboratively, it's the understanding that these possessions are really important to those individuals. Can we find storage solutions, right, to address that they can keep these items in their possession and make sure that they're protected in a safe place? But in the meantime, is there something that we can do? And Raj, I will say you're getting responses across the board that that is a great idea. So I really appreciate you bringing that up.
Thank you.
And I want to say too, Rob Fredericks also put in the chat this wonderful message about serving others. And Rob, where are you today to pull that out and be our inspiration?
I don't know, just something I was thinking of about service and our team here at the Housing Authority. Helping so many people, and some days are harder than others, but it's all about how we treat one another as humans and to make the world better. So.
We needed that this morning, that is for sure. Thank you so much for sharing that. And Rob, just in terms of who you are as a leader, you've been a mentor, you are always at the table, solution oriented, you're a nurturer, right? And when we have the hard conversations, it's the ability to have mutual support, mutual respect. It really is, something that I've learned from you, and please know you've imparted it on our collaboration as a whole. So thank you once again for having us feel inspired by you.
Thank you. I'm inspired by everyone that works in this group. So thank you. I'm inspired by you, Barbara.
Oh, thank you. Speaking of inspiration, before we go into our regional action plans, I want to talk about our steering committee. And so we've added 3 new members to our steering committee as of our last meeting. And so Renee Irely, who works with the Sustainability and Resilience Division of the City of Santa Barbara, has joined us. Andrew Rawls, who's a business owner off State Street at the Crafters Library. If some of you have been there, it is incredible, incredible space. And Liz Rodriguez, who's a COO of the Santa Barbara Hotel Group. Again, really making sure that we have representation from our regional action plan neighborhoods, business owners, city staff. We have a number of government agencies at all levels. We also have our nonprofit service providers, faith-based organizations and representatives, as well as residents and community leaders that have joined our steering committee. So really grateful that they've decided to take on the task of helping lead and provide the oversight for our work as a collaboration. Any questions on working groups before we move on to regional action plans?
Barbara, there is a question in the chat from Michael about outreach in the upper state region. Maybe we'll cover that later, or if you and Jeff want to take it now.
Absolutely. So we can cover that as part of our encampment response update. So Jeff, do you want to we'll take that and transition to regional action plans.
Yeah, thanks, Barbara. And I'm excited to hear about some new folks and organizations that I wasn't aware of doing great work. So it's really glad to meet some new people here this morning. And of course, thankful for all of you who have been doing this work for so long. To start off the discussion, I just want to remind everyone kind of what a regional action plan is and why we have them. We're trying to take a neighborhood by neighborhood approach to reducing homelessness based on some models that we've learned from over the past decade that have been successful with that approach. And also realizing that everyone's impacted by homelessness. So for most of the folks on this call, we are most concerned about the vulnerable families and individuals that are currently on the streets or living in vehicles or in our shelter system, still not housed. But there's also another side of the coin, which there are residents and business owners and hotel owners and staff that are impacted by homelessness every day as well. So the RAP was really intended, first of all, to take a listening posture and really listen to the concerns of the local neighborhoods, and then begin to work with our coordinated outreach team, such as CityNet and behavioral wellness and public health and other partners, to begin to work with those communities on plans within each region to reduce the impacts of homelessness as well. So very excited about the work that has happened. I think one of the main things that we've really seen come out of it that has really been, I feel like, successful in pushing forward some of the solutions that we presented from the working groups or from working with the city is that now most of our members within these regional action plans understand what bridge housing is. So when we go before the city or other municipalities and say we need bridge housing units and we need to have some funding for those units, because we know that that is something that those who have been on the streets longest are going to say yes to and begin their road toward housing. More than just the usual suspects come to city council and get behind that model. So really excited about some of that stuff that's happening. I wanted to just go through, we kind of reorganized our regional action plans to the first week of the month. First week of the month, we have a strategic meeting where we're talking about what do we need to implement in order to reduce homelessness. So if you think about State Street, we got some data from the ambassadors recently that there's approximately 50 plus regulars on State Street that have been there for a while. So right now we're kind of considering how do we wrap around as many services and items that those individuals would want in order for them to begin that road toward housing as well. When we look at the waterfront, we know that the major regions of focus where we're trying to bring outreach to are the parks, and by working within those parks with strategic outreach, we've actually reduced the homelessness on the waterfront. And then in the east side, we're working on a couple of things, which is the potential of, and Kayla will speak to this in a minute. As far as neighborhood navigation centers, we're looking to potentially replicate a neighborhood navigation center in the east side where we can meet people where they're at with services and begin that trust building rapport. So we're looking at that as a strategy as well. The second week is where the community can come forward and just, again, we take the listening posture and they can report how they're being impacted by homelessness, and we work with the city and other providers to try to meet those business owners where they're at and help them, whether that be learning about de-escalation or help by bringing the outreach team directly to their block by block approach. We'll do that. This week is my site visit week. So I went to the waterfront. Gosh, time flies. What day did I go to the waterfront? I went to the waterfront on Monday and just went with 7 different partners to see what's happening on the waterfront. And the good news from that walk was the reflection I got generally from the community is a thankfulness for the team that's doing the great work because they feel like they're being heard. And also that impacts that people are receiving services and exiting homelessness. So they're excited about that. So I do an East Side walk and a State Street walk tomorrow. And then the last part of the wraps of last week is data reports. So that's where, because we want to create a culture of transparency and accountability and to show that everything Barbara talks about, you know, what we're doing within the working groups, what all the partners are doing, that it is having an impact. So we have reports every month from the city. It might be Renee Irely reporting on from the Encampment data. It could be Pat doing their monthly report. It could be us reporting on the work we're doing, or CityNet often will do a report based on the idea of trying to get 100 individuals out of homelessness this year. So went through all that. Next slide.
I love the exchange that's already happened in the chat. Michael was sharing some concern of individuals on Upper State. And Emily from CityNet replied that there are outreach workers that have been walking up and down the Upper State region trying to help people and connect with them, and that specific to this woman, because there was enough details provided that they have tried to engage with her. But before we get into progress and results, Jeff, do you want to just talk a little bit about movement we're seeing overall and how we're trying to address that with the frequency of the meetings with the regional action plans?
Yeah, I think it's hard. I mean, from my perspective, there's always a certain amount of movement, and the reason why we created the regional action plans was so that we aren't just moving people around who are experiencing homelessness, that we actually have a plan for each region. We're actually, we have solutions connected to our outreach. So there is movement within different regions all the time. I don't know if I'm answering your question, Barbara, because I'm concerned about sharing anything specific without actual data. Because oftentimes I will get report. So I guess I should say in this call that a good third of my time is just responding to emails of concern from businesses, partners who have opinions about homelessness, sometimes not based on data, but based on the feel like there's 3 new people or something like that, but I don't necessarily have any data on it. So I think what we're trying to do is, whether we're talking about upper state, whether we're talking about State Street, East Side, waterfront, is know everyone by name, know what they want, what they need, and get them connected to the resources. So I don't know if that answered the question accurately.
Absolutely. I think in general, because multiple strategies are being deployed simultaneously. So we're having enforcement of encampments in fire-prone areas. We're having more enforcement of no overnight camping in our local parks. And we're having more opportunities for resources, right? So word is out, however we can support people. And so we're seeing, an increase in traffic with our neighborhood navigation centers, because we have these beautiful cards now that highlight the day and time and the providers that are there on Tuesdays and Thursdays, so that we can connect with people and be able to start those conversations or continue those conversations. And the work that's happening with the encampment response and the bridge housing units that are in the upper state region, there is some correlation that they're seeing more individuals experiencing homelessness in that region, but that correlation to the bridge housing units has not been substantiated through data. So that is
Right.
a part of general movement. And I appreciate that, because now that we have outreach and case management by sitting in that region, that they have extended beyond the bridge housing units and are trying to reach folks that, again, have gravitated to that region for a lot of a variety of reasons. So it has been amazing to see that, because we meet so frequently, the regional action plans, we're hearing immediately from business owners and residents if they see something different, new, or we're continually hearing about individuals that haven't accepted support. But we know if we have that intensive case management and outreach and that continual interaction, that the odds are that at some point they will say yes and accept those services. So the fact that we have so many people contributing to those solutions, I feel, is why we're seeing so much progress in a short period of time.
Yeah, and I'll put the encampment link in the chat so everyone can see that. I mean, it's really important for me for the data piece, because I hear all the time, let's just say related to State Street, is worse than ever, or it's better than ever, and it's just, I can't base anything on that. And so using the encampment link, all that data now goes to the city, and we can actually look at the most impacted regions now as people kind of report. They can both report situations that need attention, but they can also report individuals or families in need in the encampment link. So I really appreciate.
Yeah, Liz Stotts actually put both of those links in there.
Oh, she did.
Scroll up in the chat box, both of them are available. Yeah.
Yeah, so the more we can do based on, I mean, that's a big part of collective impact. The more we can do based on actual data, census, point in time, encampment link, rather than opinion or hearsay, the better off we're going to do. And I want to say the other thing, I want to give a huge shout out. I don't think she's on, her picture's on, but I think Woman of the Year should be Emily Cobalt.
Yeah.
I mean, I'm just going to say, with Sydney, I would give a huge shout. We're going to give a huge shout out to Sydney anyway. But when I get, she's on a lot of the emails I'm on, and they know the folks, they know the situation. They're already involved in it in some level, and so I just really appreciate how on top of it she and her team are when it comes to knowing the full spectrum, responding, of course, loving on the individuals they have helped, they've assisted through the system, but also being respectful of the concerns of the community. That's a really hard place to balance, and she does an excellent job. So if there is an award given from some organization, I'd say push it that way. or maybe we'll do the SB Act Awards at some point.
Yeah.
Sorry,
Well,
got
and
off track.
I would always say that everyone deserves an award, but I think every
Right.
person on this call would vote for Emily to be the person.
I
of the
think so.
year. So,
I think so.
so yeah. We have a question, Jeff, about a decision to redefine the designated East Side encampment geography. Can you address that quickly?
Yeah, so I will also put in the chat my email and when all the wrap calls are, because we will probably be addressing that at a future wrap call, especially the East Side waterfront mapping consideration, because I know there's been some discussion on the East Side call about some potential changes on how those maps were created. So if you want to join those conversations, I would say that's the best place to join. Would be it's going to be on an East Side call coming up.
All right, so we wanted to just remind everyone, this was our goal around the regional action plans, which is 100 street exits by the end of 2021. And as Jeff mentioned, this has been happening through weekly meetings, intensive case management and outreach through the primary provider in the city of Santa Barbara, which is CityNet, but behavioral wellness, New Beginnings, there's so many organizations that are doing outreach and case management to make sure that we're successful in reaching this goal. Flexible resources. So when we talked about diversion and reunification, that if we can meet someone's needs and even putting them in residential treatment or other treatment programs, whatever it takes, this is what we're talking about. Can we understand what this individual needs, what this individual wants, and be able to meet them where they're at? And advocating for an increase in bridge housing units and shelter bed capacity overall, temporary or permanent, to be able to, again, safely shelter the individuals that are currently experiencing homelessness in an unsheltered environment. So this is our progress to date, updated as of the last encampment response regional action plan. So we did separate this out because we did feel our 100-person goal was both ambitious and achievable. And our total right now has exceeded that, but we really wanted to differentiate that encampment response bridge housing program, because that is significant resources that have been approved by the city council leadership and the mayor of Santa Barbara to make that happen in a 120-day pilot program. This has been successful in placing individuals from encampments into those bridge housing units and be able to provide those necessary wraparound resources. So as of our last update, that was 54 individuals that have been placed in those bridge housing units as a result of that encampment response coordinated citywide effort. Jeff, anything else you want to speak to just in terms of the regional approach and separating out? Again, these were additional resources approved by the city of Santa Barbara in the last 6 to 8 months that have created the additional 76 street exits that I would say weren't originally part of our plan, but we had every partner advocating for resources to be distributed to those areas and deployed in support of that strategy.
I would just say, so again, this is based on data, right? So we worked with Emily on a survey for some of the folks in our different regions based on, what would they accept as the kind of a first step to move out of homelessness and bridge housing. Hotel rooms was number one, right? So it shows, I think the main thing that this kind of just, it blows this myth away, which I hear all the time, which is, I've talked to 4 people and they don't want help. They don't want services. But the fact is, to go into the encampments where service resistant is the term people might use, and to have the ability with the hotel rooms to offer those through a team that already knew the individuals and there's already trust, it shows that most people do not want to be homeless, right? It just reaffirms most people, everyone on this call believes, that most people, this is not a way of life that they want to live. And if we make the right decisions and fund the right things and have the right teams, we have good results. So it just isn't rocket science anymore. It's just, we know what to do and how to do it, and we just need to do more of it. And so when we talk about the funding piece, it's well worth the funds put towards this process, and really thankful for the city and all the partners in CityNet for making this happen.
Absolutely. And I wanted to, I think Kimberly is on with us. Kimberly Albers with the County of Santa Barbara. First, good news, and I did not know this, so thank you so much for bringing this to my attention, that FEMA has extended their support of the non-congregate shelter project room key until December 31st. So huge news, again, as we emphasize bridge housing and project room key as really a best practice approach that has happened as a result of the response to COVID-19. And Kimberly, I also wanted you to share maybe about the county-wide efforts to support encampment response, because we have had a few comments of there are encampments now popping up in other fire-prone areas. Hey, calling on someone that's probably trying to do 200 things while on this meeting, but I want to make sure if we have the time. And Kimberly can correct me if I'm wrong, but there is a proposal going before the County Board of Supervisors for a comprehensive, coordinated response to encampments in fire-prone areas across the County of Santa Barbara. So once Kimberly's able to join us and perhaps share in the chat when that proposal is going to be going before the Board of Supervisors, so we can engage and advocate and support for those resources to be prioritized, that would be great.
Hi, Barbara, this is Kimberly.
Yes. Okay, great.
So I guess I want to make sure a little clarification, appreciate that shout out. So we are going to the Board of Supervisors with a encampment resolution strategy, but you know, we obviously can't work in all jurisdictions without MOUs, et cetera. And so we're just starting with an encampment response team that would work in the unincorporated areas, but certainly many of the strategies like supporting you. Hopefully everyone saw yesterday, the Board of Supervisors passed approved a $1.3 million contract with Good Samaritan to provide the intensive supportive services for the emergency housing vouchers, which obviously key strategy for those folks that are going into bridge housing, as well as getting others directly into housing. We have other initiatives. Hopefully everyone's heard we had a new shelter open in the Isla Vista area on July 1st. So all of those things, right, help us address encampments and will be emphasized in the presentation, which will now go to the board on August 31st. But I did want to clarify that, you know, we would not be working like the actual response teams and in cleanups. The proposal is in the unincorporated areas at this point, not to go across a jurisdictional line to, you know, have our fire work where your fire is working. So we hope that this will be a model. The protocol, obviously the Santa Barbara's been doing a lot of this work and definitely informed some of our work. But our protocol will be something that could be replicated throughout the county in the different jurisdictions. But we're super excited about just taking some steps forward. I guess I do want to remind everyone that the Center for Disease Control guidance on encampments is still absolutely active. And so we want to make sure, as the city of Santa Barbara's been doing, that we're offering you know, non-congregate sheltering or individual housing when we're clearing. And so appreciate all of the resources being dedicated to that. So hopefully a little bit of clarity there. Lots of great stuff going on. Hopefully yesterday also at the Board of Supervisors meeting, housing navigation services to support the day center at the Father Cordero Center was funded by the Board of Supervisors. So some great things that the county is supporting in the city of Santa Barbara, but happy to answer any questions since I'm here.
Great. Thank you so much, Kimberly. I really appreciate that. And I know that it's been all hands on deck across Housing Authority and the County of Santa Barbara for the emergency housing voucher program as well. And appreciate just the proposal clarification around unincorporated areas. We know that word has gotten out, as well as some, you know, observations of activities of clearing encampments. There is a very specific criteria to designate those encampments in fire-prone areas and being able to prioritize resources for clearing of those encampments, because as Kimberly said, we are still really trying to make sure that we're following those CDC guidelines, because that has been a successful approach so far in the last year and a half in responding to COVID-19. So we aren't dispersing encampments in general, but encampments in these fire-prone areas specifically because of public safety concerns to our community overall. Anything, Jeff, to add on regional action plans? I want to make sure that we turn it to Kayla for neighborhood navigation before our presentation on SB Connect Home.
Nope, that gives good information if you want to join when the wraps are.
Great. Thank you so much, Jeff. And Kayla, Neighborhood Navigation Center, we've just launched our second location. So please just take a few moments to share an update about this, again, incredible group of partner organizations that are working to serve our unsheltered population throughout Santa Barbara.
Yeah, thank you, Barbara. Thank you, Jeff. So yeah, my name's Kayla. If you haven't met me already, I've met a bunch of you and excited to meet more and work with all of you. But yeah, so over the past couple years, Alameda Park has kind of blossomed on Thursday nights into this collaboration of a bunch of different service providers, from Showers of Blessing to pet care to Doctors Without Walls. I see Kathy on the call. And the model has been successful in providing a dignified space to provide services for people and also move them along that relational pathway that we keep talking about, with those relational conversations and connections and case management that moves people towards housing solutions that are individualized and right for them. So it's so exciting and successful that we're able to launch a second one. And just last week, we had a soft launch of the second Neighborhood Navigation Center at the commuter lot, and we're still working through the logistics and connecting with clients at the Carrillo Castillo commuter lot, which is a different neighborhood than Alameda, and a lot of different particular individuals that are getting care from behavioral wellness, from Doctors Without Walls, Showers of Blessing. We're excited to have CityNet join us in September with some case management on site for those particular individuals, engaging those services. And then we're also looking to move to a third site later this year. We're doing some kind of site scouting right now on the east side in particular to address the needs of that neighborhood, kind of following the regional action plan model to really address impacts in particular neighborhoods as well as individual needs in those neighborhoods. Yeah, and we had a neighborhood forum a little while ago with West Downtown to address neighborhood concerns, and we heard just this kind of resounding support for the work that's happening thanks to the dedicated attentiveness of our partners, particularly in that neighborhood. So I'm excited about it. I'm excited to work with you.
Thank you so much, Kayla. And we're so happy to have you on board to help expand what we find to be just a really effective model of working in neighborhoods and meeting folks where they're at. And I think, as you pointed out so beautifully, is this in combination with the regional action plan, so that we have targeted resources on enforcement, but then really coordinated resources when it comes to providing supportive services to individuals living on the street. And that is when we can build trust with both residents and business owners, as well as individuals who are experiencing homelessness. That is our goal with the Act on Homelessness Collaborative, is to reduce homelessness and its impacts in the city of Santa Barbara. So this is where we are. This is our progress as of the second quarter of this year.
Can I add one thing, Barbara?
Mm-hmm.
Well, I think if you look at between the neighborhood navigation centers and the RAPs and the outreach that's happening, and even the library looking to bring on a social worker at some point in the fall, once everything gets figured out, you do have this safety net actually kind of visibly being created. And we have the opportunity, like working on State Street with the neighborhood navigation centers and the ambassadors and CityNet Behavioral Wellness and the library. We have an opportunity now to really case manage, I feel like, well, and not duplicate. I think that'll be a big part of what we try to do through all these different sites and regional action plans, is try to cover the bases with everyone and make sure we're offering something that people will accept and keep people moving through this document ready process. And Kayla, I don't know if you mentioned, we're looking to that these neighborhood navigation centers would be coordinated entry sites.
I did forget to mention that, but yeah, that is what we are looking to do. Jeff, if you want to.
No, that's a really exciting development, because starting people on that process of getting their data entered and getting their documents together, and what we see with neighborhood navigation, what I'm beginning to see, it's thanks to Roger came up with the idea of that little card, and then Kayla's been handing them out, is that people are coming to the parks looking for their service provider. They're actually, and so they have a coordinated entry site. Be known as a coordinated entry site for people, I think, will be very effective.
And we know full well the coordinated entry system is is the pathway for people to, for us to understand their needs and for people to be connected to the appropriate resources. So being able to expand the capacity for coordinated entry is one of our priorities with the Neighborhood Navigation Center, knowing that we could very well have more people in need post the eviction moratorium being lifted at the end of September. So I wanted to mention that, you know, we try to approach everything with rose-colored glasses, but I will say we've had some difficult conversations to date in trying to anticipate what that need could be post September 30th for our neighbors that have been struggling for the last year and a half because of COVID-19. Job loss, financial hardship, losing a loved one. We know that youth have been struggling as well, just in school, out of school, childcare being just a huge part of the challenge to families. So we are having conversations with Department of Social Services, other county agencies about how we can do our part to really try to mitigate that as much as possible, in addition to the rental and utility assistance, which is millions and millions and millions of dollars of support that have come through the county continuum of care and through the federal government. And again, making sure that we have the capacity, hopefully, to address whatever need there may be. And if we don't, that we have an emergency plan to be able to respond. So we ask for everyone's empathy and compassion and patience as always, as we look at what could potentially be a trickle, I would say a trickle effect, because eviction is a lengthy and costly process. We know some landlords will be patient and will take the time for their tenants to go through the rental assistance process. And we know some landlords, because this has been a financial burden for them and their families, will be pursuing that process. So we're going to do whatever we can to get as much information we can beforehand, resources coordinated as much as possible, and being able to help families before that happens. And if something happens, that we're able to support them on the other side. So we do have some concerns along with our day-to-day work already. But again, thank you in advance for working with us as we try to maintain the incredible progress that we've been able to achieve in the past 2 quarters of this year. And lastly, before we go to Liz Stotts with SB Connect Home, we wanted to share that we've had the opportunity to work with TVSB, and some of you have worked with this agency as well. I think too, our nonprofit partners know how much it costs for good marketing material and educational and informational material. And TVSB has done this for us in coordination with city staff and city council leadership to really highlight and get out there the work and the services that are being coordinated on behalf of the Act on Homelessness Collaborative. So we have 3 different videos that have been released so far. One has been on the Neighborhood Navigation Center model and the work that's been happening at Alameda Park as we're expanding to the commuter lot location. We also have one on the regional action plans and how that works with business owners and residents specific to the waterfront. And then we had one on general homelessness services. Again, what the city of Santa Barbara is doing to be able to reduce homelessness and its impacts over the next 3 years. So really grateful. It's something that we wouldn't be able to otherwise afford making happen. So thank you so much for those additional resources. And lastly, I'll say that City of Santa Barbara and City Council made a $100,000 commitment to the Neighborhood Navigation Center model. So beyond bridge housing, beyond encampment response, beyond CDBG funds that go to homeless care and shelter care providers, and beyond the departmental costs to be able to reduce homelessness and its impacts in the city, they are also working to help us address the needs of our unsheltered population. And we have worked to match that with private resources and received a very significant grant award from the Natalie Orfla Foundation of $65,000. This is why we have the flexible resources to be able to expand to multiple locations and eventually to a 3rd location before year end. So this is not possible without both city investment as well as private funders. We've had community donations, individual donations from our working group members, and we cannot thank you enough for making this all possible. That's why we're excited to report this progress to you every quarter. All right, so this is the end of our progress update with the 2nd quarter of this year, and I want to move into, many of you have asked about SB Connect Home as a project, its impact. I think you have heard in past meetings how it's been a coordinated effort across multiple agencies to address the most vulnerable individuals in our city. And so we wanted to take the time to be able to share the outcomes of that work in the city of Santa Barbara. So Liz, I will turn it over to you. Great.
All right, can you see my presentation and is it
Yes.
big enough?
I believe so.
Or if I need to zoom it out, let me know. I can't see what you're seeing, so.
Oh, that's great. That's even better.
Okay, and I'll make it a little bit. Okay, so I'm Liz Stotts. I'm with the city of Santa Barbara, and I was part of a large team that initiated the Santa Barbara Connect Home program, and it was funded with heat funds, and I'll explain a little bit, but that funding source ended June 30th. So we thought we would be a good time to reflect on what has happened with the last 2 years with this funding and how the program evolved and the impact that it had. So all our partners are here to kind of be able to answer questions. We wanted this to be kind of a roundtable discussion about what we learned and anything that they've, any partners would want to know that kind of would let us, have a discussion. So the Santa Barbara Connect Home project, as I mentioned, was the result of the state of California making available homeless emergency aid program funds. That was HEAP funding. We had applied for a significant grant to provide not only street outreach, but bridge housing with tiny homes on Korean Castillo lot. We did not get sufficient funding to do the whole project as we had wanted, so we scaled back. So the purpose of it was to prioritize and house the most vulnerable clients through finding them housing opportunities and getting them into a safe housing. The project timeline was from April 19th is when we started, and June 2021 is when the HEAP funding ended. That doesn't mean the project has ended. We have continued it with other funding sources. So I don't want people to think that the project ended. This is just a reflection period. The contracted partners with this funding was the City of Santa Barbara, CityNet, Cottage Health, and Santa Barbara Restorative Police. And we had established MOUs with the Housing Authority of the City of Santa Barbara, People Assisting the Homeless, and the Fire Department and AMR. So they were all a crucial part of this effort to outreach to the most vulnerable clients that have been identified and providing the case management services to get them permanently housed or in a safe location. So as I mentioned earlier, the focus of the population was people experiencing chronic homelessness and vulnerable individuals that were utilizing crisis services at a higher rate. So ER visits, ambulance calls, interactions with police. Eventually, as the project progressed and word got around about what this project was doing, we started getting feedback and referrals from community partners such as SB Act as part of the as part of the RAPs. There would be discussions like, "Hey, there's this guy on this neighborhood." So the SB Connect Home project became a partner in that respect. And then with the encampments, as needed. Mostly, sorry, I lost my train of thought with the encampment. It was as needed as the priority need came up. SB Connect Home was there to help out as needed, even with encampment. So some of the services that were delivered, as I mentioned, was street outreach. That was the bulk of it. Case management and support services. So in housing, on the street case management, if people were placed into housing, they also received case management and supportive services. The oversight of the person or the support of that person that didn't end with placement in shelter. It continued. getting them housing document ready. The mobile navigation center, which that was the crucial part with having Cottage on hand to help us out, was providing medical services as needed where the person was residing on the street. We helped provide shelter and housing opportunities, again, through our partnerships with PATH and the Housing Authority. We did a census count early on. And then as COVID came on, the SB Connect Home program really helped in that and providing that response. One of the things we ended up doing with the heat funds was diverting some of our grant funds to provide portable restrooms throughout the city. When everything was shutting down, restrooms became an important component that was needed. So we redirected some of our funding to provide those portable restrooms. And as part of that evolution, again, as I mentioned earlier, the referrals from local businesses, the State Street ambassadors started referring to the SB Connect Home program. The City of Santa Barbara, the website reporting tool, which has been posted on this chat, became a useful resource, and the SB Act rep calls. Okay, and then I will pass it on to Emily Cobalt to talk about the rest of the project.
Hey guys, happy to be here. So one of the really awesome parts about this project was it did involve a multidisciplinary team that involved CityNet case managers, a Cottage social worker, a Cottage registered nurse, and then the city restorative police officer. What was awesome about this was it allowed us to go out into the streets and connect clients immediately to medical care. We were able to witness things like wound drainage happening in a park or eye drainage happening in a park. We were also able to connect people to Medi-Cal before providing them shelter so that we could possibly get them into long-term nursing facilities as a housing option. Restorative Police was also a great partner with us, and they were able to provide us with some housing opportunities using their own funds, as well as reduce the number of citations for our clients so that we were able to house them and had less barriers in the future.
Let me know whenever you want me to move the.
All right, we can go to the next slide. I'm like, I realized I didn't have that power. And then another thing that, CityNet and the Connect Home team recognized was how much this project has created community partners and collaboration amongst those serving our clients in the city of Santa Barbara. We wanted to give a brief shout out to those who really, really helped us. And this isn't to say this is a final list of those who were involved in our project. In our case study, we had up to 14 collaborative agencies coming together to help one individual. And so I really want to recognize the beauty of bringing service providers together, bringing resources together, and then really just filling out the gaps between different agencies, right? We know one agency can specialize in one thing, another agency can specialize in another. And so we just wanted to give a huge shout out, especially to PATH and Rescue Mission, as well as the Housing Authority of the City of Santa Barbara for those vouchers. Our local motels during COVID, we also pivoted and we provided shelter to 30 individuals in a non-congregate site. We provided 3 meals a day. And so there were also meal vendors who were involved in the care of those clients. Trader Joe's donated meals to us as well. And so it really was a community effort to help our clients in need. You can go to the next slide, please. Here are some of our project outcomes. We were able to effectively enroll 265 active clients throughout the 18-month project. We had 4,168 service transactions. I am so impressed at this because, again, we had to pivot during COVID. We had times where case managers had to quarantine because of exposure. There were times where we only had 2 case managers out there, and there was never a gap or a stall in our ability to serve our clients and make sure that everyone stays safe during the pandemic and throughout the care of this project. We were also able to get 148 street exits to shelter. And again, that was using Rescue Mission and PATH, as well as some in Bridge House up in Lompoc. So I wanted to let all of our shelter partners know we really appreciated your support. Next slide. for supportive housing focused. So again, this project was really unique in that we were able to follow our clients from street level homelessness into housing, and then for up to a year after, using permanent supportive housing model. We were providing even more hours once clients were housed to help maintain their housing. We were making sure that they were accessing food, connected to GR and sources of income, making sure their houses were clean, connecting them to IHSS workers. And through all this effort, we were able to have a 98% retention rate, and we served 19 of the top 50 highest utilizers of emergency services. Next slide. And I'll pass it off to Monica.
Thanks, everyone. Hi, everybody. I'm Monica Ray with Population Health at Cottage Health. And something that was unique about this project is that there was a healthcare component to the street outreach that we were doing. And actually, excitingly, there was a report that was published shortly after we started this program out of LA. It was an impact report reflecting on 10 years of implementing a model similar to this. And in seeing that impact report, it really highlighted how much of the work that we've been doing through this project has pulled out the best practices that they've found to be true, and where they've seen really positive outcomes, and in addition to cost savings that they were able to calculate across the multiple organizations that were involved in a project like this. So from a Cottage Health perspective, we had two members of our team focused on this, a social worker, Sal Robledo, and our nursing team, who was Julia Petrus, and then has now become Maggie Pack-Greeley, our nurse. And providing these resources out to where individuals are located, we focused on 62 individuals within the whole that Emily mentioned. And that was focused on providing medical and intensive social needs support. And those individuals were prioritized based on those who were utilizing crisis services at the highest rate. So police, fire, AMR, emergency department, and inpatient services. And our nurse went out and provided services, medical services, where the patient was located, as well as provided follow-up care afterwards. So contacting their physician, filling their prescriptions, helping to provide much of that case management support that's also required, not in the field. And then the social worker, similarly, Sal did similar things in the sense of utilizing his skill set and triaging mental health needs, providing therapy services in the field, following up outside of being on site, and helping to connect to basic needs. And then also providing through that social work skill set, the ability to connect to a skilled nursing facility. And on the next slide, here are a few kind of findings from the work that we've been doing over the past 2 years. The demographics and basic demographics of those that we've been working with are mostly Medi-Cal or Sen-Cal, with about a third of them being Medicare, which also speaks to their age when you think about the age of this population. And then about 11% were Hispanic or Latinx. In terms of type of support, about 40% of those individuals needed a high intensity medical follow-up. So this means more than one visit a week. And that was our nurse coming out to visit that individual more than one time a week. And that's, when you think about 62 individuals, a pretty high number, but speaks to the medical needs that they have going on, as well as about 46% of those individuals needed high intensity social needs follow-up. So that's a continued follow-up from the social worker and providing support. Anecdotally, we've heard that there have been decreases for these specific individuals with police and fire, AMR visits. And then as well for emergency department and inpatient visits, we've seen some reduction in their accessing and need for those crisis services. With that, I'm going to hand it back over to Emily to talk through a patient example.
Hey guys, so we all know Joe at this point, I feel. But this is Joe, and Joe was experiencing homelessness for over 16 years, and he'd been a staple part of our community, living off of one of the ramps primarily. And so he was part of the top 50, and part of this project was, of the top 50, we couldn't take no as an answer. If clients were not interested in services, we had to go back out and try again and try again. And I think that was the beauty of this project, was the resiliency and just how our case managers were dedicated to these clients' engagement. So it took us 14 hours of street outreach in order to get this client to sign our HMIS paperwork to officially enroll him as a client. And that was over a few months. So after that 14 hours of street outreach, it then came case management. And case management took us about 94 hours to get the client the adequate medical needs, as well as their document ready status and connected to a housing opportunity. And this housing opportunity came through the Housing Authority of City of Santa Barbara, one of the units that they had recently built. And so we wanted to give them a shout out for providing more units for our clients to move into. Once the client got housed, it took us 61 hours of housing stabilization services, and this was within half of the time that it took the 94 hours of case management, just showing how much work it takes to keep our clients housed, because after experiencing homelessness for 16 years, simple things like where to do my laundry, it's not in your kitchen sink. You know, it's those types of lessons that we're having to re-educate our clients. And so we just wanted to point that out, that, you know, the need for permanent supportive housing services is out there. And once our clients got housed, we don't want to forget about them. We want to make sure that they maintain their successful units. This took us 13 months total with 14 collaborating agencies. There was 168 interactions with Joe during this 13-month period. And so if you think about the capacity of each case manager, we like to make sure that we're able to provide that intensive case management model. And then here are some of the results. As Monica had said, what we were looking for was a decrease in emergency services usage by our clients. And so there's an 83.3% decrease in the number of emergency room visits. Prior to being housed, Joe used the emergency room average of 6 times per month. After being housed, he used the emergency room just once. And then there was also a 99.8% decrease in calls from police involving Joe. Between 2014 and 2020, he had 951 calls from police while he was experiencing homelessness. And after being housed, he had 2 in 13 months. So we just want to use Joe as an incredible story as to why this model works, how this model works, and all of the effort that it goes into housing someone who is extremely vulnerable, chronically homeless, and is in need of this intensive level of case management. Next slide.
And Emily, we had a question about that being typical or an outlier for the cases that you manage.
I would say this is typical. Again, without the data, we can't make an accurate assumption. What we're seeing with those who are highly vulnerable with chronic homelessness is they do require that high level of permanent supportive housing services. And they even need that level beyond 1 year. So we're connecting them with IHSS workers so that they're able to continue with getting in-home care for those who qualify. And then in terms of outreach engagements and case management, that I would say that's completely accurate for anyone experiencing homelessness. It takes that number of hours and you know, that amount of time in order to get them ready for housing. There's some cases where they're easy reunifications and diversions, which is why we keep on pushing for more resources to support that cause. There are other times where someone gets a lottery ticket and gets to move in a month, but those are the outliers. So, yeah.
Great. Thank you.
Sorry, I had muted myself. And then this is just a summary that I think Liz will be reviewing for us.
Yeah, I want to open it to questions. So this is just a repeat of what we've learned. But I think we'll say this over and over again. We need this type of system of care with street outreach and engagement with the focus on long-term support services in order to be successful.
Absolutely.
And with that, we'll open it to any questions.
Great, thank you, Liz. If you can stop sharing your screen so we can see folks in terms of comments and questions. And Monica, appreciate you sharing the impact brief from LA. I think again, the more evidence we have to really support and justify these significant investments in specialized outreach, coordinated outreach, as well as addressing the needs of our most chronic as well as vulnerable individuals experiencing homelessness helps us in any way possible. And Liz, just again, to maintain our commitment to transparency and accountability, can you share the total investment in this SB Connect Home in the last 2-year period, and then how you're able to support that program moving forward and at what level?
So in terms of the 2 years, it was strictly heat funded, and a lot of us partners provided in-kind care. And I don't have the dollar amounts to quantify it for you, but for example, the administration, the reporting, and all the other requirements of receiving this large grant was taken on by the city of Santa Barbara without any reimbursement. So we committed our staff time to it. With Housing Authority, they set aside vouchers as part of a commitment to this project. And somebody from the Housing Authority could probably speak to the number of vouchers, but the direct funding went to funding the street outreach for CityNet, the caseworkers for Cottage, and the nurse practitioners, and the restorative police department.
Thank you, Liz. I appreciate you clarifying that too.
And then, the funding, I think somebody from CityNet can speak to it more. There's a lot of funding sources that have been made available since then. CityNet has secured additional funding to continue this HEAP grant or this SB Connect Home project in a smaller scale. But at the same time, the city of Santa Barbara, as you've mentioned, the Encampment project, that was made possible with city general Measure C funds and an infusion of permanent local housing allocation funds, which we have made available to CityNet for case management, street outreach.
Great, thank you, Liz. Any other questions for all of the incredible partners supporting SB Connect Home? We usually hear frequently that we need to communicate more and to a broader audience the very amazing efforts of our collaborative partners. And so we're trying to get better at that. And many of you saw we won a grant with the Hutton Parker Foundation for an insert in the Santa Barbara Independent, and that happened in June. Again, an opportunity to educate folks about the collaboration, our goals, our progress to date, and just really addressing some misperceptions in this about individuals experiencing homelessness, the TVSB videos, really looking at the case studies, which CityNet has done great work at capturing, as well as some of our other partners like New Beginnings and Housing Authority. And then really coordinating with these broader projects about the data, both quantitative and qualitative, to be able to demonstrate to you all that these investments by the city of Santa Barbara are yielding really, really positive outcomes overall for our 3-year strategic plan. Jeff, anything you want to add before we transition? I know that there's a county meeting at 11 and many other responsibilities that folks are juggling today.
No, just an appreciation for everyone and all the hard work everyone's doing, and knowing that we're going to continue to need to pull together and work together as we face new challenges, essentially moving forward in the fall. But really just impressed with everyone's work, and Evan and I are working specifically with some of our RAP partners on once we do finally get through this virus, some kind of appreciation events that we just want to put on for the community, as far as self-care, and do some raffles and have some fun and provide a good meal for everyone. So just haven't been able to do it yet, but it's in our heart for you. And so thanks for all the work you're doing.
Absolutely. And we want you to know that we've had our regional action plan partners say, we are so ready to host a party for our provider partners that have been working tirelessly out for the last 1.5 years and much longer than that. And we're excited actually to have that come to fruition. And when it's healthy to do so, we will make that happen. I hope you can feel our gratitude through the screen, as well as for City Council, city staff and leadership. We have resources available to us that have been, from what I've heard, greater than has ever been experienced among our collaboration and our partner providers. We're able to deploy those strategically. We have a strategic plan that we've been advocating for alignment of those resources to be able to achieve those goals in a 3-year period. And we are very much on our way because of all of you. So thank you so much. We will see you next quarter. We have a few key meetings coming up. The Housing Retention Working Group is meeting on Monday at 11. Our Housing and Shelter Working Group is meeting on September 13th at 1. We also have an encampment response meeting this coming Wednesday at 10 o'clock. We record those meetings, they're available on YouTube, and we will also send the recording of this meeting to everyone who's participated today and registered to participate today. There's been some requests for the PowerPoint presentation on the outcomes of SB Connect Home, so you'll be able to have access to that data through the recording as well. And again, happy Labor Day. We are coming up on Labor Day, if you can believe it. So I hope you can take some time to rest and enjoy time with your family and friends. So thank you all for being here this morning, and we will see you again very soon. Thank you.